There are new concerns this morning that we could see more cases of Ebola outside of West Africa. A study published Monday says up to 3 Ebola-infected passengers could fly overseas from that region every month. Researchers say health screenings may not work if people are infected but don't show symptoms.
Now, that report follows CDC changes that outline how U.S. healthcare workers should treat the patients. They start with rigorous and repeated training in the use of personal protective equipment. That refers to the suits Ebola workers wear. The guidelines require that no skin is exposed while wearing that gear, and they also call for trained monitors to make sure that the suits are put on correctly.
Proper training isn't the only issue hospitals are juggling with Ebola. They also need to determine what to do with the medical waste. Tracy reports on the staggering amount just one patient can generate.
This is your weak point right here. Do not lean over the patient. Go around.
Hospitals around the country are scrambling to train their healthcare workers to protect themselves from the Ebola virus. But plans for disposing of an Ebola patient's medical waste are not so clear. Each potential patient can generate about 8 55-gallon barrels of hazardous material each day. That's because their bodily fluids and everything they come in contact with, from hazmat suits to sheets, mattresses, cups, and plates, must be disposed of. At a recent congressional hearing, the head of the CDC said there are guidelines to deal with this waste.
Is Ebola waste as contagious as a patient with Ebola?
Waste from Ebola patients can be readily decontaminated. The virus itself is not particularly hardy. It's killed by bleach, by a variety of chemicals.
The medical waste can be sterilized or burned, but many states do not use medical incinerators anymore because of air pollution concerns. The California Hospital Association sent a letter to Senator Barbara Boxer warning that storage, transportation, and disposal of this waste will be a major problem.
Typically, when you're a patient in the hospital, you generate a little bit of waste, and we know how to deal with that. But because of the volume and the highly contagious nature, those two factors combined, it does present some new learnings for us as we go along here.
And it's not just hospitals. 140 55-gallon drums of contaminated material were removed from the Dallas apartment where Thomas Eric Duncan had been staying. He later died of Ebola. The waste was incinerated this past weekend at a facility in Galveston, Texas. For CBS This Morning, Tracy, Los Angeles.